wait just a quick second for the room to load.
Come on, little dog.
Okay, wow, there's a lot of people here today. Okay.
Hey. And I'm here. I'm just going to go close the door, but I am here.
Right, the room is still loading, Chair. If we would just wait another few seconds here. Please.
That's fine. That's fine.
Okay, I think we can go. So Chair Smith, if you are ready to call the meeting to order at your leisure, please.
Thank you. I call the meeting to order for issues for Tuesday, January 5 at 10 a.m. Administrator Schmidt, you may start off.
Thank you, Chair Smith. And if I may, I welcome to the Commission Chair Trudy Smith and Commissioner Mark Shull. Welcome. This is your first business meeting with the Board of County Commissioners. Welcome. And our returning county commissioners, Commissioner Sonia Fisher, Commissioner Martha Schrader, and Commissioner Paul Savas. So all commissioners are present. Quickly, as you all know, issues is a chance for me as your administrator to bring before you very quick updates that are just giving you some informational updates, or perhaps to seek your very quick direction for a support letter or a very quick decision that doesn't warrant a full policy session. But I am being more restrictive on these issues list because I admit in the past they have really become policy sessions, which is not the intent. So I will do better, and we'll start with that today. Staff will come in and out to help me present these items. So with that, let's begin with our traditional, actually, if Commissioner Savas, do you want to say something first?
Yeah, just Gary, you may already cover this, but I just wanted to clarify. I guess we have an abbreviated schedule today, so we're not meeting in the afternoon today. I have a medical procedure I need to head off to at the late noon hour, so to speak. So I will be heading out to that, and hopefully I'll be able to sit up straight for the first time in 3 weeks, which will be nice, I hope. So if you see my camera off today, that's because I've been laying on the floor for the last 3 weeks, pretty much, because it's about the only position I can actually be comfortable in. So I am here. I will be listening. I'll participate the best I can. And please be patient with me today. Thank you.
Paul, I hope you get better soon. We wish you the best. And just know that you are in our thoughts and prayers for a speedy recovery.
Thank you.
And thank you, Commissioner and Chair. Yes, there are no policy sessions this afternoon, so we just have this issues this morning. We have until between now and 11:30 a.m. I think we can get through the list, but if not, with the Chair's agreement, we would continue this afternoon. But again, I do feel we can finish this morning. So with that, we'll start with what we have been providing to you weekly, Commissioner, or twice a week, is a wildfire update. We have Nancy Bush, who is Director of Disaster Management and Incident Commander of our Emergency Operations Center. Nancy, would you please go ahead?
Yeah, thank you. And good morning, everyone, and welcome new commissioners as well as our other commissioners. Welcome back into the new year. So I'm going to be going through the Wildland fire update, but I am going to give some background for our new commissioners and also to remind everyone that was here through the last year kind of what has happened and where we are now. And then we'll do the same as we go through COVID, which will be next, that Gary will announce. So Christina, if you'll please bring up the slideshow for me. All right, thank you. So we are going to we're calling it 2020 in review as far as the EOC is concerned. There are just a few pictures of some of the wildland fire that we had. There was some, amazing and pretty great devastation that we had in our community. As you know, we were fortunate in that we weren't like Jackson County, who had 2,500 homes that were destroyed. So we had 62. Next slide, please. Just briefly, I'm going to talk about how that whole week started. We did have a windstorm that weekend before we had the wildland fires. And we worked, myself and one other staff, which was Jamie Poole, worked with PGE that entire weekend to say, you know, are we going to be, does PGE want to shut down the grid, the power grid on the Hood and the 26 corridor in order to help prevent wildland fires? What is the weather looking like? So through that weekend, we were sending out messages to the community. We were working very closely with PGE, and we did end up shutting off the power for, I think it was around 10 days before it came back up on that corridor. So that is how everything started. That is part of the declaration that we had from the feds. So that windstorm is part of the declaration. I want to make sure that that's clear because I think we forget that sometimes. So next slide, please. So the fires actually started at 12:17 a.m. on September 8th, or approximately that time. That is the time that I was paged. And I rolled out of bed and came in here and we opened the EOC. I actually called the county administrator Schmidt at I think around 1 o'clock. I know it was on my way, and I know I was like, hi Gary. And he's like, it's probably not good if you're calling me at 1 in the morning. And it is not. So that's when it started. And we actually started the evacuations at that time. And we set up at the CCOM building with what we call the Fire Operations Center. And we had several people in there from fire, and we were calling shots from there, doing evacuations. And at that time, we were doing level 3 and getting people out of the way, which means it was like, you need to leave now. So we worked through the night doing that. September 29th is actually when all the evacuations ended, and we put everyone back on a no level here in Clackamas County. November 3rd, we transitioned from response to recovery. November 3rd is the actual date that FEMA said the event ended. So we are now officially in recovery. And of course, in 21, we're going to continue going into recovery and rebuilding. Next slide, please. So the acreage we had burned here in Clackamas County, Beachy Creek in Lions Head. Beachy Creek was quite large, but most of it was around 190,000 acres. Most of that was in Marion County, but 46,323 acres were here in Clackamas County. Riverside, which of course was the largest fire that we had, was 138,054 acres. Beachy Creek, Lions Head, and Riverside are those were federally controlled at one point. Eventually, the feds came in to take over the management of those two fires. Unger, Dowdy, Wilhoit, Graves Creek, and North Cascade are all fires that were dealt with locally or from the state. Unger was 497, Dowdy was 1,509, Wilhoit 532, Graves Creek 46, North Cascade 2584, and we had almost 190,000 acres total here in Clackamas County that were burned. Next slide, please. So just to remind everyone, at the peak, and you can see our map over here to the side, everything in red was under a level 3 at one point. At the peak, that was 52,371 residents that were under the go order. Under level 2, which is the get ready, which means you need to have your car packed, and in case you go to level 3, you need to get out. That was almost 108,000. And then of course in the green there, they were on level 1 because the entire county was on either a level 1, 2, or 3 at one point. So those in the green were then also in level 1. We lost 62 homes, 214 outbuildings, and there were 110 properties that were damaged in the Clackamas County Wildfire Complex. Next slide, please. So we did get a federal declaration, and this is the first time in several years we got individual assistance, which means that individuals, the public, could actually get assistance. And you have to meet certain thresholds in order to get that. In Clackamas County, I have been here almost 13 years. This is the first time we've had an individual assistance declaration since I've been here. So it was a challenge because it's the first time we've been through it in a long time, and things had changed at the federal level. But we had 2,352 that registered. And remember, this also includes the windstorm. So it's not just the fire, but also the windstorm. Of those, 88 of those could get household assistance. which provides them like with rental assistance, a place to live, those types of things. And there was $406,000 that came into the county from the federal government for those individuals or families. Other needs assistance is 122, and that was 152,354. Other assistance is things like childcare, if you need a ride to get to a medical appointment, funeral costs, if those are needed. So it's those types of things. And then the individual and household program, which is 159. And that is helping to repair homes and, seeing, if you need a home replacement, those types of things. There was 159 there and 555,641. We had 2 households that got the maximum, which is $35,500 for this particular category. When you look at other counties, there are a lot more in those counties that met that maximum and got the maximum reimbursement. The Sba Disaster Loans for homeowners, there were 35 for businesses too, at $2.4 million here coming into Clackamas County. Next slide, please. During the Wildland fires, we did a lot of outreach. It was everything from, how do you rebuild? How do you get permitting? What to expect at permitting? Fire Resource Center is like we had places where people could go so they could get more information, talk to someone one-on-one, and get a lot more information about everything that's available to them, not only from the feds, but also from the state and the local government, which is the county here. And then also we had FEMA at the centers as well. And the website, we had everything also on the website. We had 261,700 unique page views, which means if I went in and hit it 3 times to do something, I was only counted once. So that is pretty high because we know people came back over and over just to see. It's like, oh yeah, I need to go look this up now because it changed frequently. Next slide, please. Also, we had our social media community outreach, and this is one of our tweets that we had in Spanish. 366,000 engagements from 450 wildfire posts. An engagement means either they made a comment or they did like hit the like key or that type of thing. So they actually interacted with us. Next slide, please. So this is where we are now. We're working on debris cleanup. We have approximately 4,000 trees here in Clackamas County that need to be removed from our right-of-ways. That cost is around $4 million. At this time, we're working with ODOT to do, they're on an IGA because the state is picking up all of this cleanup, and they are also picking up the 25% share cost, which we would have to bear here at the county if the state wasn't picking that up. But the estimate for these 4,000 trees is $4 million. And the personal property cleanup, the hazardous waste has been completed. And we have, actually we had right entry forms that the individual had to sign, and it was completely free to them if they did sign that. Not all of the properties decided they wanted to use this, but we did get the information out to all the properties owners so that they would know that they could have this. And then we also have personal property cleanup, which is also pending on the IGA, which we're working with at the state, but the state is doing that cleanup as well for our personal property owners. Next slide, please. Just a couple more things I wanted to mention. So for fire, we had about $1,871,000 that were total expenditures. About 1.6 million of that is personal services. Of course, that's our staff, which of course is going to be the most expensive part. Materials and services is almost 300,000. And we, will continue to have some costs related to that for debris in particular, because even though we do have the state that's helping do the cleanup, we're going to have people here that are going to be interacting with them. So there's going to be some staff time that will be added to that, but we will turn all of that into FEMA, and we should get at least 75% of that back, because we do pick up 25%. That's the match here. So that is all I have for Wildland Fire. And Gary, do we want to open that up for questions right now?
Yes.
Board, have any questions on this? So with,
Yes, Chair.
I don't see any. With that in mind, Nancy, do you want to go on to the next issue?
I'll do that, please. So next, commissioners, there are three current emergency declarations declared in Clackamas County. The first is a COVID-19 emergency declaration. The prior Board of County Commissioners in December approved extending that declaration through the end of February 2021. So that is still in effect. The primary reason for that is that it allows us to receive state and federal dollars. That is a primary reason why the county extended that emergency declaration. There are two, though, that are up for your consideration today, both of which expire this Friday, January 8th. So we're seeking your approval to either extinguish or move forward. Sorry, I didn't mean to say that word. To end or continue these two declarations. The first is our wildfire emergency declaration. Please bring in Stephen Madcor as well, Christina. Nancy, would you give an update if you recommend the board continue this declaration, or is it time to end that declaration?
Oh, I'm sorry. This is the general wildland fire declaration. Yes, I would suggest that we go ahead and end that particular declaration, because we are in recovery and we no longer need that. That declaration is really for that period of time where we were actively fighting fire, getting people out of the way, bringing people back in. So I would suggest that we sunset that one.
Gary, does that require a vote of the board?
Stephen, do they need to vote to extinguish or to end it, or just let it expire?
As it stands today, it's going to expire on the 8th, and you don't need to do any further action other than if you wanted to extend it and add additional terms, you would need to vote on that. But if you wanted it to expire, you would just do nothing.
So I'm going to ask the board, is everybody in agreement in Nancy Bush's recommendation to let this particular declaration expire on the 8th?
Yes, let's let it expire on 8 January.
I don't hear any opposition to that. So Stephen, I think we'll let this declaration expire. Gary, you want to move on to the next?
Good. Next is the other emergency declaration. It is for wildfire, hazardous waste and debris removal emergency declaration. Nancy, do you recommend that the board extend that one?
Yes, I do recommend that we do extend that one, because we are still working with ODOT to get everything cleaned up. And it's recommended that we keep that one and extend it, I would say, at least 30 to 45 days as we work through our IGA with ODOT.
30 to 45 days does not seem like a lot of time to me.
Yeah, you can extend it longer. It's probably going to take, I would say, 8 to 12 months at a minimum to do cleanup.
So if we only extend it 30 days, for instance, we'll have to come back and extend it again and again and again.
That is true.
So what would be your recommendation on the length of time that we extend this declaration?
I would say probably, I would extend it up to a year. Because
Why don't we, board, I'm just going to throw this out. Why don't we extend it to January 31st of 2021?
Do you mean 2022, Chair Smith? Or this year, or this month?
Well, when does this expire?
So it expires this January 8th, but you said January 31st, 2021, which is.
I meant December. I meant December 31st of 2021. Thank you for the correction. So I'm going to throw that out. Is there any discussion about an extension of the wildfire cleanup declaration to December 31st, 2021? Commissioner Fisher.
Yeah, I appreciate the effort to save board and staff time on this issue.
I'm good with this, except I'm pretty sure that if we don't need it anymore, that Nancy would come back and tell us that we can get rid of the emergency declaration. With those guideposts, I'm good with it.
Absolutely.
I don't see any other, oh, Mark, Commissioner Schrader, did you want to say something? No.
Commissioner
No.
Savas has his hand up.
Yeah, okay, Commissioner Savas.
Yeah, I just wanted just to clarify that the cleanup costs, just for the sake of people who are listening in and for the future going forward, that the cleanup costs are being covered and absorbed by the state of Oregon. Is that correct?
Yes, sir, that is correct. And that is for our tree removal as well as personal property.
Okay. And on a side note, I know that we had talked about because of the unique, well, unfortunate experience, but also a unique opportunity for us to, number one, train people, bring in apprenticeship programs, opportunities for operating equipment, so on. I just want to just make sure that we're taking all the efforts we can to employ people locally, ideally, Oregonians, ideally Clackamas County residents, and that we're using as much of the material as we can for mills or wood products or whatever kind of materials for Oregon. So again, we're doing as much as we can for economic development and job development and so forth, the training opportunities as we can. So I don't know. I know that's a lot. I know that's really not part of the not part of the initiative here to extend this to the end of the year. But I just want to make sure that all those things are covered because we have talked about them over time. I just want to just clarify and bring to everyone's attention that that's one of our goals, and when and how, if there is still interest in doing that. Maybe that question is to Gary. When and how would we get some kind of a update to that as to the metrics of how we're doing on those particular efforts?
Nancy, can you help me answer
Yeah,
that?
I can, yes. So yeah, Commissioner Savas, we certainly hear what you're saying, and we have been working with the state to do that as much as possible, but it's not our choice. The state has the contracts and the state is directing the work. So with the IGA, I mean, we're making sure there's some things in there, and we're working with them too, because we do know, for example, that we might need some trees that we want to use in some of the streams and that kind of stuff, or you know, in other capacities. And we do know that the state is encouraging that they use local subcontractors to do the work as well. But because the state is taking this role on and they're paying for it, we do not have that, we don't make that decision, sir. We are doing the best we can as local agencies. I know that we're not the only county that is bringing that to the table, but the state makes the final decision.
Okay, so if is it out of line or out of order to at least submit some kind of a letter requesting that, so that number one, not only did we say it, but at least we have on record and on file something that we have submitted to the state to ensure that we achieve as many of those goals as possible.
Yeah, I mean, I don't think there's any harm in writing a letter, but I think some of those decisions are probably already made.
Okay.
Yeah.
Thank you.
Stephen Madcore.
Yes, thank you, Chair. We have this matter listed on your upcoming agenda for the business meeting as a public discussion item. And Nancy Bush, are there any additional terms that you're requesting be incorporated in the extension, or just existing terms?
I believe it's just existing terms, but Steve and I will take a look at it again, just to make sure we don't need to add anything. And
Perfect.
I know that later today.
Thank you. We'll get that prepared.
Okay, commissioners, is that it on this particular issue?
Chair, if I may confirm, is the board good with the December 31st, 2021 expiration date?
Yes.
Great. I'm seeing head nods. So you don't have to vote today, but we will add this to your business meeting agenda for this Thursday for you to formally take action there. So Christina will send an updated agenda out at the end of this meeting. If I might go back to Commissioner Savas, were you requesting a letter then, Commissioner Savas, to send on the workforce issues?
Gary, could you just give me a couple minutes, please?
Yes, of course. All right, we'll loop back to that. All right, let's move on then, if that's okay, Chair Smith, and we'll come back to Paul when he's ready.
Yeah, that's fine. Go ahead, Gary.
So next is coronavirus update. So Nancy Bush will provide this, as well as Philip Mason Joyner, who is the county's public health director and co-incident commander of our emergency operations center. Please go ahead, Nancy and Philip.
All right, thank you. So we will roll right into that. So Philip has the first slide, so I'm going to turn it over to Philip.
Good morning, everyone. Thank you so much, Nancy and Gary. Good morning, commissioners. Yes, really appreciate the opportunity. Just like Wildfire, we'll share a little bit of information about where we've been, what we're seeing now, and where we're headed as we move forward together. And thank you, Christina, for doing the slides. So next slide, please. So public health had been monitoring COVID-19 in December of 2019, January, when we first heard about this new novel virus that was impacting our globe. And on February 28th of 2020 is when Washington County contacted us to notify us that one of their residents was the first case in Oregon that tested positive for COVID-19, who happened to work at a grade school in Lake Oswego. That's really when the bulk of our work has begun. We were the first county in Oregon to declare a state of emergency, and we fully activated our EOC, bringing in staff across all county departments to help us to respond to this crisis. On the 23rd of March, the governor signed the first really big significant executive order, the Stay Home, Save Lives campaign, recognizing that this is very unknown virus, the need to quickly limit interactions outside of homes, asking the community to do that and focus on meeting essential needs only. Not having testing, not having the PPE needed to protect our healthcare workers, that was the focus of that decision. And then the new phases, the phases for reopening businesses, the approaches to get our kids back in school. It's been a long, challenging journey. On May 23rd is when our phase 1 reopening application was put into place. And the previous board, we spent a lot of time advocating for the needs of Clackamas County residents, our businesses, the need for more resources. And that work continues. The governor now has a new risk-based framework for reopening schools and businesses that are aligned and have less metrics, only 2 metrics that really guide that. But still challenges and a lot of concerns related to this. But that is a high-level overview of the timeline. There's a lot that we could discuss, and I'm just going to share some of the highlights today. So next slide, please, Christina. This is Clackamas County specific case counts, where you can see since we had our first case back in March all the way through current as of last week, what our case counts look like. And it also shows you the different points in time, such as major holidays or different significant events related to response, such as different reopening restrictions and the fires that all played a role in our case counts. Clackamas County, we're public health, we're responsible for case investigation and contact tracing. So calling individuals that test positive for COVID-19, identifying anyone that they've been in contact with, getting a hold of those folks to let them know that they've been exposed, connecting them to testing if it's needed, providing them with guidance on isolation and quarantine and what they need to do to protect themselves and their families from this virus. Next slide, please. The hospitalization is incredibly important metrics that we look at closely, along with bed capacity in our region. Oregon ranks 50th in the nation in terms of per capita bed capacity. So that certainly is something that our hospitals are very concerned about. We want to make sure that if someone does get ill for COVID or another medical need, that they have access to quality services, that our healthcare workers who have been working so hard aren't overwhelmed. And that's certainly one of the drivers in the decision makings from the state level about some of the restrictions that we have to ask the community to put in place around limiting their interactions and trying to do what they can to reduce spread, along with following the public health guidance that we've been providing community all along, wearing face coverings, practicing physical distancing, and good sanitation. So this shows you hospitalizations of COVID patients in the hospital across the state of Oregon over time since March. And then the next slide. This is specifically looking at the Tri-County, so Multnomah, Clackamas, and Washington counties. This gives you a look at the total number of beds that we have in our local hospitals. That's the blue number on top. The yellow boxes are the available beds. And of course, this changes on an ongoing basis, and this data is just pulled once a day that we receive. Gray shows you the current beds that are in use for ICU beds. Next slide. And as I mentioned, there is a new, fairly new, as in the last month, a new process for reopening businesses and schools that are based on these two metrics. Clackamas County is still in the extreme risk category. As you saw the weekly case count, I expect that this will still remain in effect. Currently, it's through January 15th, but again, I anticipate that we'll still be in the state for a while until we get this case rate per 100,000 population number to 200 or less. Once we move into that, at that phase, it will allow for in-room dining at restaurants, more indoor entertainment to happen, and fitness centers to reopen at limited capacity. And next, Nancy, I believe you're gonna share the next couple slides just around the work we've done with some of the community outreach and engagement and support that we've been able to provide businesses.
Thank you, Philip. So Christina, thank you. Again, we just separated out the websites, the community outreach from Wildland Fire and Coven, because we wanted everyone to see, kind of where we were with some of these. For the Wildland Fires, it was a very tight time frame that we had that many hits. We do continue to have them, but for COVID, it has been, again, through March through December. So for our website, which we have always put all of our information up there that we've gotten from the feds as well as the state and what is happening here locally. So there were 339,000, almost 340,000 of the unique page views. And again, that is, if I went and did 3 hits there, I only am counted once. Next slide, please. For social media, there were 108,250 engagements. And again, that is if someone hits a like or they do a comment, but somehow they engaged with us, they just didn't read it and move on. And then we had 670 COVID posts from March 2020 through December. Next slide, please. We've also done quite a bit of support for our businesses. And I want to talk a little bit about what we have been doing out of the warehouse here at Clackamas County. And we have had so much support from our facilities management staff to make sure that we could get this done. So one of the things, so we have 317,535 masks that we have actually sent out to our businesses, 23,461 face shields, the 107,800 gloves, and 3,221 bottles of hand sanitizer. A couple of things I do want to mention here is like gloves. We've sent out a lot of them to our businesses, but we've also sent a lot of them out to our fire and EMS and several others as well. And gloves in particular is really a hot commodity. And right now we're seeing people that are really needing gloves. We're not able to get them in. But that's one of the things that we're seeing a lot of demand for. And part of that is because our healthcare workers, as well as anyone who works in restaurants, et cetera, all over the country are needing them. We also have, this is just the big items or the larger numbers that we have, but we also had bleach, sanitizing wipes, spray bottles, goggles, Tyvek suits, scrubs, shoe covers, thermometers, air purifiers as well that we sent out. The customers, I want to call them customers, that have gotten things from our warehouse and through our system here, healthcare offices, including dentistry, chiropractic, and wellness centers. Our long-term care facilities have come to us, and we've been able to help them out as well. Adult home care, small businesses, community-based organizations who have been working really hard in our communities, trying to make sure that they get all the information out there and can provide as much as we can to those in those communities to help keep them safe, as well as our agricultural businesses. Next, oh, and just one more thing I do want to add here, food boxes, which really is a lot of this folded together with COVID and Wildland Fire. Those two collided as we went through our year, but we did 5,605 food boxes this past year since March, to help our struggling communities, residents, et cetera. And we saw, it was interesting because we saw these dips during Wildland fires, you know, because it was harder to deliver because people weren't there because we had evacuated. But we did over almost 6,000 food boxes this past year. Next slide, please. Also support for our county businesses. Our last grant applications, we had 330 business grant applications. We have now awarded 280 of those, and they're still going through those and continuing to award for those that have applied and are eligible. We opened 3 business resource centers as well. And CARES dollars covering those was approximately $4.9 million that we've been sending out. We also had two earlier rounds for our businesses. The first round was around $500,000 and from BCS. And then the second round was, was around 500,000, I believe. So throughout the year, we have tried to help our businesses as much as we can. Just a reminder here as well, we have around $17 million that was earmarked for Clackamas County for us to spend for COVID. Early on, we were not allowed to help our businesses out. Eventually that was added to what we could spend, but we had to spend it and then get reimbursed for that. So some of our neighboring counties, the feds actually gave them, because of the population, they got direct awards, where Clackamas County and the other counties in the state did not. So that we've had a lot of interaction with our business communities because they hear things going on in Multnomah County, Washington County, and we struggle, to really get everyone to understand. It's like we didn't have the same amount of cash that they did. Next slide, please. Okay, just real quick on COVID, I mentioned how much we had spent for fire. On COVID, it's a little over $21 million so far. 12,500,000 is for personal services. Materials and services is 5.3 million. As well as we did some capital outlay, which was just 103,000. Let me see, we also had some cost allocation, which a lot of this was cleaning and things we had to do in our buildings, was 341,000. So Philip, I'm going to turn it over to you to talk about moving forward in our schools and vaccine.
Thank you. So yes, two of our top areas or bodies of work we're focused on right now is supporting our schools with reopening for in-person learning. The governor did change those reopening metrics for schools to make them advisory and not required. So that's a very good thing. Dr. President and I are meeting tomorrow with all of our Clackamas County superintendents to talk about where they're at in their timelines and how we can continue to work in partnership as we have all along throughout this pandemic. We do have over 150 schools in Clackamas County. They were all required to create reopening plans, and we dedicated a couple of staff to review every single one of those plans to provide feedback on what they can do to put more public health precautions in place and work with them to provide that technical assistance. We continue to convene the schools and have staff that are available to help our schools if there's a case or an outbreak in the school community that will work proactively with them. I think it's incredibly important that our youngest learners get back to in-person learning as quickly as possible and want to support them in doing that. For vaccine distribution, so there's a lot going on and it changes every single hour. To date, 4,400 of our residents in Clackamas County have received their first dose of the COVID vaccine. So this is primarily our residents that work in our local hospitals, along with staff and residents at our long-term care facilities. We did at our Clackamas County clinics receive our first allotment last week, 1,000 doses last week, and we'll receive another 1,000 doses this week. That's focused on first responders. So they've been prioritized. Firefighters, EMTs, frontline deputies, and staff working in our dispatch centers, such as CCOM, which is our 911 center. We will continue to follow OHA's guidelines around which groups receive the vaccine next. That information is available on OHA's website. And we're just trying to work through the process. And I know that there's a lot of desire to get vaccine into arms and looking to have those shipments continue to come and get other providers and pharmacies and clinics enrolled so that they can begin to distribute the vaccine. That is where we're at with vaccine distribution.
All right, thank you. I think we can open it up for questions now. So Christina, you can take down the slideshow.
Thank you, Nancy and Philip, on this. I have a couple quick questions and then we'll open it up. On the 4.9 million for CARES for businesses, how much of that are businesses having to repay?
None.
Well, I've had reports from some businesses that they're having to pay back a percentage of what they have received.
Not on our grants. No.
Okay.
If they have different grants from, like, there were a lot of grants like from credit unions and those types of things.
Oh, no, this is, Nancy, I don't know if it's CARES. Is there something else that went out that would possibly indicate payback on that?
Not from the county.
Okay, thank you. That's all I need to know. Of the $21 million that the county has incurred in costs, did I hear that right?
Yes, ma'am.
Have we been fully refunded or made whole on that?
So the 17 million, we did get reimbursement. We have about $1 million we still need to spend from the 17. So 16 million of that. Some of the dollars are also related to some other grant funding that we receive for CARES, like some block grant funding and emergency services grant. So that is also, I won't say that there's no general fund in here, but there's very little.
So yeah, well, money is money. So we have a 21 million spent. We've been reimbursed 17 million, which is 4 million. Where did, if it's not general fund money, where did it come from? And are those monies capable or have the potential for being reimbursed?
So the dollars, the other dollars are going to be like from the block grant, which is grant funding that we get here. And it was earmarked specifically for CARES. And that's what we've used like for rent assistance, utility assistance, et cetera. And there is some other grant funding that we've used to help cover some expenses as well. And probably some of the general fund that we have spent, we probably can't get reimbursed for because we would have already done it. Because
How much do we know how much that is?
I don't have that number in front of me.
Well, later on, let's get a number on that general fund dollars, and I don't know what we can do about it, but if the legislature has any allocations going forward to possibly reimburse counties for their general fund, we probably should take a look at that.
Yes, ma'am.
Thank you very much. I will say I had a tri-county meeting last night, my first tri-county meeting with Catherine Harrington and Deborah Kafori, and the governor's staff person was on there. And I asked specifically, what are the efforts being done to vaccinate our teachers? As we know, that's probably important in opening our schools. I would like to hurry up with that. I'd like our schools open right now, as so many of us would. Thank you, Philip Mason Joyner, for mentioning that. There's evidently a problem in the distribution on getting the vaccinations out, which I'm quite astounded by, because we have known for a long time that the vaccination was coming. And maybe planning efforts should have been underway to get this going. Philip, does the county have any role in planning how to get vaccinations to our teachers in a timely manner so we can open our schools?
It changes all the time. Sometimes we get informed that the county has a role that we find out later on. At this point,
that's a good answer.
At this point, my understanding is that OHA will be leading. They're now required, as they reopen, to have testing and vaccination plans that they will coordinate directly with school districts. We'll likely have a role for the independent, about 30 private schools we have in the county, to help support them, as they don't have school nurses, most likely. They'll need to be connected to vaccines, and we'll certainly be able to provide those services to help.
So the OHA is going to take the lead role in our public schools.
And working with the occupational health and insurance companies for the teachers to get the teachers vaccinated.
Yes, okay. And just a little caveat on the vaccination. I've had several people email me and are concerned that the vaccinations are mandatory, and of course they are not. It is not a law yet of mandatory vaccinations. So I just want to put that little caveat out there for any of our citizens who may be listening. I do believe it is still a choice, but the vaccinations do offer us an opportunity to pivot and open up. So with that in mind, do we have any other commissioner comments on what has been presented so far?
I think I have my hand up.
You know, I'm trying to see here, Martha, I don't see it, but go ahead. There you go.
So there's a couple of things. I want to thank you for that vaccine question, Chair, because I had some questions about that too. It seems to be a very slow rollout. I'm certainly understanding the prioritization of who's getting it. Who is actually giving the vaccines, where, when, and how? Is it our staff at our health clinics? Is it a combination of hospitals? Is it the logistics of how the vaccine has to be delivered that's causing kind of a slower rollout? I mean, is it because you have to have people come in to a building, get a shot, but you can't have anybody else in there because you're physical distancing? And also that you kind of have to keep people there, I've heard, for like about half an hour to make sure they don't go into anaphylactic shock or have some kind of reaction. So what's the process? I'm just trying to figure out that process, because it sounds like it's a logistical issue that just may be the nature of what we're going to have to deal with.
Yeah, this distribution is quite complex. Hospitals are receiving allocations directly. We are receiving allocations, and so we received 1,000 doses last year. We have over 900 first responders. So some of the fire agencies will take the vaccines and be able to administer it themselves. Others, such as some of our local law enforcement, that'll be something that county staff actually provides the vaccine for those essential workers. And then with the long-term care facilities, there's a federal pharmacy program where the feds have contracted with pharmacies and they send mobile teams to their locations. So there's multiple prongs and approaches for how the vaccine is distributed. Our next grouping, even in the last hour, Oregon Health Authority said that they had this linear process for getting healthcare workers such as hospice care and folks working in high-risk congregate settings, that we had to follow a particular order. Now they're really trying to speed that up, and they've loosened some of that. So it continues to change every day, every hour, every minute. I hope I'm answering at least some of your questions.
No,
Well, Philip, if I can interject, Emily just sent me some notes from last night's meeting, and I'm sorry I didn't bring it up sooner, but I'm learning the technology of going back and forth between our Zoom and my Outlook Express email. Last night it was reported that the state is vaccinating 10,000 a day, and the 1A group is a priority. I believe that's our healthcare workers and our first responders. Teachers are listed in the first grouping. I think they are 1B.
1B.
Yes, if that's right. Thank you, Martha, for helping me on that. I also suggested in our meeting last night, if the governor's office or the OHA could be more proactive in communicating to the public who gets the vaccinations first and the groupings, because maybe commissioners do have it. I'm getting a lot of telephone calls saying I'm 80 years old. I should be a high priority because of my health, because of my age, and on and on and on. And there's a lot of people in the not categories. You could be 65 years old and you're considered high risk, but you may not get the vaccination for months and months and months. So we offered that, the three chairs offered that up to the governor's office. Hopefully they will be coming out with some communication points. I also suggested if the governor's office or OHA could at least communicate directly with our county commissions on what exactly these groupings are, if we don't have them, and then maybe we could do our own PR, put out our own press release to the community on what they mean. And maybe we have that already. I'd like to see some more proactive communications from our public health department and PGA on at least weekly press releases or twice weekly as events unfold, because there is a lot of pent-up frustration, if not downright anger. And people are looking to our county governments because they know that we are public health. And it's not good enough for us to say, oh, Oregon Health Authority is handling it. That's not good enough in my estimation. So Gary Schmidt, I would like you to direct staff to get that out, and let's start being proactive in our communications with the public. And I just might want to do a video.
Mhm.
I'd be more than happy to do a video on a Facebook and get it out that way too on the county site, because I think this is very, very important. The expectations are that people want their kids in school. The kids want to be in school. And I'm not going to go into the long litany of problems associated with that. We all know what they are. But I think as a commission, as leaders in our community, we can do a better job in communicating these health occurrences and updates, and make it very clear that, number one, that the county health does not distribute the vaccination, nor do we give it. I think that's important. And hopefully, and figure out what the heck the OHA is doing, and say something like we're giving 10,000 vaccinations a day. I have not seen that anywhere in the news, in any newspaper, on any station. So you know what? Let's make the news ourselves. That's just my recommendation. I see Paul Savas, you're in the queue.
Thanks, Trudy. You have touched on something that has been kind of a sore spot for, I think, all of my colleagues, past and present, with regard to the COVID and the state's role. And I think it might be a good idea when you talk about communication, and we ought to be doing, I know that Nancy and Gary and Dr. President number have heard me express on for different reasons, different times about, I thought the state could do a better job on communication. And it seems to me that just the scale of the communication that needs to be done statewide for statewide issues could be spent wiser and more efficiently and broadcast if it's done at a statewide level. So I see quite a few advantages of the state doing it, provided of course they do it well. And that's not always the case. And provided that what we say on a Tuesday doesn't change on a Friday, which it has in the past. So it's been very challenging, but I think that one thing that might be helpful, especially in light of Commissioner Shull being in his first couple of days here as a commissioner, and even for Commissioner Smith, and actually for each of us to go back and read our responsibilities, and that is defined, and maybe we can talk about that, and maybe Mr. Madcore can send out a copy of what our role is as the
Public health.
health for Clackamas County. We have, when we take the oath of office, we have a certain role and a responsibility that is very, very unique as a county commissioner, that city officials, for example, do not have, or water district officials do not have that same responsibility that we have. And complicated to that, where I'm going with this, is that we're in this untenable position, in my opinion, I've expressed this before, where we're responsible, but yet we don't have any role in setting the rules or making some of the adjustments, because that's done at the statewide level. So we bear the burden, but we don't have much ability to control or influence the change, I think, that we ought to be making responsibly. So I think it might be a good opportunity, or even a short work session, just to remind ourselves going forward, because this is not going to be over next week. We've got months to go yet before we're out of the woods on this. But I think it'd be a good exercise, especially as we go forward and figure out how we communicate, because we at least owe the public, and I'll say this again, we at least owe the public good, clean, clear messaging from all 36 counties in the state that is clear. And unfortunately, when everyone puts their finger or their toe in the water and starts making comments, sometimes those things get confused or mixed up, or maybe they're not accurate. But at our level, we have a specific responsibility to again, meet what that role is as the Board of Health, and try and play an important role. Now, what has happened, Commissioner Smith or Chair Smith, you now have the new position of being the chair. We have had to work in this unusual environment where instead of the county trying to communicate with the governor, we've had to express to Chair Bernard in his role previously, to express that to the tri-county chairs to see if we can't get the governor or the governor's staff to listen there to make these changes. So we've got this, I won't say fractured, but we've got this system, if you will, where we rely upon the chair to talk to the other chairs to come up with something that might make it to the governor's office to make a change that we necessarily don't put in writing. We take minutes of these meetings, but the way we've gone about it, I think we could do better, frankly. I'm not sure where we are going forward, but to make sure that the messages are correct, or that what we're seeking is that of all three counties. And I'm not necessarily sure that sometimes all three counties are in the same place or ought to be in the same place. So that's a lot to say. I'm sorry for being long-winded on this, but this is a topic I think we need to spend some time on and some work on. And maybe we can have a work session maybe next week on this very topic in a constructive way.
Thank you, Paul. I appreciate your comments. Martha Schrader.
Yeah, I just want to go back to a quick question to Philip. So you're saying there are multiple prongs. Is there any streamlining of the system that you're seeing anytime soon that we can speed things up?
I think, the governor's press release with the goal of 10,000 a day, and I think more resources are being put to it at the state level to get us moving around logistics and to, as we get more providers enrolled to be able to administer the vaccine, I'm hopeful that it will move forward a lot more rapidly than it currently is.
So they'll give us a blueprint of where to get it, how to get it, but we are not actively, as a public health entity, actually given the shots. That's what I want to clarify. Because
We're
that's
working with our health clinics to give shots for first responders.
And I do think, and Martha, that's a really good point. I think we do need to say that. I do think we need to educate the
Big
public
confusion
somewhat on what is happening and who's doing what.
like there's no there is what I get concerned about.
Yeah.
And I really think that we have to, I just have one more question, and it's not about vaccines, but I did have a question about bed capacity. Are we talking actual physical beds or like the space in the hospital with beds already there?
Because it's the beds that are
Yeah.
opened up that have the staffing and the equipment and the physical beds itself that are available. That's what we're looking at. And a lot of it has to do really around workforce. There might be a vacant bed, but if there's no staff to provide the health services, that's one of the concerns.
Yeah, just to add to that a little bit, Commissioner, that's why you see the bed capacity go up, because it's really around staffing.
Okay, thank you. It's staff
Thank
driven.
you. Commissioner Fisher.
Hey, Philip, I really appreciate all of your very detailed and concrete information today. I'm just wondering, I'm hearing that people not being able to understand if they're in group, say 1A, I'm hearing they don't know, they contact their healthcare provider, they don't get information, they get sent to boilerplate information directly like to the Oregon Health Authority website. They can't get an answer on where to go to get the vaccine. I'm just curious, where is the best place for us as commissioners right now when we get these calls to send people? What do we advise them to say, how do they get the vaccine if they are in one of these priority groups?
At this point, I would rely on your policy advisors to send it to the EOC, probably to our PIOs. We're still working locally on web content and messaging, and we do have some responses that we've worked to craft to get back to people and following up with folks, so we can help lift that. But I think Chair Smith's comments about the overall communication strategy at the state level and also at the local level, there's work that needs to be done, and I know it's happening within our EOC right now.
Okay, so maybe, I don't know, are other commissioners getting calls about that? I know that I am. Maybe we need to, Gary, just sort of centralize that so EOC doesn't hear from every policy advisor. Just a thought, so we can get information to folks.
Yes, let me work on that, and I'll get back to you, commissioners, on a central point of contact.
Thank you, Gary. Commissioner Scholl.
Commissioner Scholl, your microphone is off.
Yeah, here we go. The most important issue in the county for the people I talk to is when our school is going to open. So this transparency issue on informing the public as to where we're at, to give them an idea when their kids can go back to school is going to be not just an informational thing, but a psychological health thing for the county. So the sooner we can get an idea when those teachers can get inoculated and give the people some hope as to when those kids are going to go back to school, this is a hugely important thing. And so we need to come up with a plan to get that out across the county as soon as possible. Thank you.
Thank you, Commissioner. Sonia Fisher.
One last question. So Philip, we all watch the news, and what's happening in the UK right now is really concerning with this second strain of the virus. What planning are we doing proactively in Oregon to prepare for that more contagious strain of the virus? And do we know if the current inoculations will inoculate against that second strain?
Is it a strain or is it something else?
It's a strain, essentially sort of like a mutation. So yes, it's here in the United States where we recognize that, we're aware of it. It is looking like it is more infectious, so that's a concern. We don't know if it's more deadly. Vaccine scientists, are saying they do think that the vaccines that are becoming available will be effective. So that is great news. I know AstraZeneca, they aren't yet approved in the US, but they should be the next one coming online. They did come out and publicly say that it will be effective. So that's the most information I have at this point. And in terms of anything different that the community would be asked to expect, the public health measures around face coverings, physical distancing, limiting your gatherings, hand sanitation, those are still the measures that we would want folks to follow. They're the same, whether it be the COVID-19 we've been dealing with the last year or this new strain. The actions, the precautions individuals take are the same.
And then in Los Angeles County, they're rationing things like ambulance service. Is there any planning in Oregon looking at rationing if this strain comes to us? I mean, what's happening now in our state?
Yeah, we meet regularly. Dr. President, her counterparts, the Oregon Health Authority, the hospitals, our first responders meet frequently and have plans for what to do if our hospitals get overwhelmed, or our medical resources get overwhelmed. So that's something that we thought in the spring we might actually have to activate and use. Thank goodness we didn't. But we've done a lot of exercise, a lot of planning updates, and I feel pretty confident that, hopeful that won't come to be the case. But if it does, I feel pretty confidently that we have a lot of expertise in this region and will be prepared to do so if it's necessary.
Thank you. Any other comments that need to be made on this briefing? We have a lot of issues left to go, and it's 11:10 about, so I have a feeling we're going to run long. We may have to go into the afternoon hour to get everything finished. So Gary, what's up next?
I do agree, Chair. I apologize. This has gone slower than I thought this morning, but they've been excellent questions and great updates. So before we close this on coronavirus, first, I've talked with Chair Smith and she's agreed. We're going to have these updates only weekly, commissioners, not twice a week as we have. We're going to do them on Tuesdays here like we're doing today. So we will not have an update on your Thursday business meeting as we have been. If circumstances change, we can revisit that. But for now, these will be weekly updates on Tuesdays. Finally, just as you know, commissioners, but for the public listening, Clackamas County is still open for business. We've always been open for business. Our main county buildings, the Public Services Building and Development Services Building is open to the public between 9 a.m. and 3 p.m. Monday through Thursday, our public counters, as well as we provide services remotely, digitally, online, remotely as we have been. Most county employees have been working remotely since this started almost, a year ago, back last March. I have been very upfront and transparent with employees 6 months ago and forward that we are planning on a return to the office for many employees beginning this month in January and ongoing with my promise to them that we will do it in a way that's safe and measured for the health and safety of our employees and for the public. So commissioners, I've been working with disaster management, human resources, county council on this return to the office plan. It's almost finalized. When it's done, I'll share it with you as well. But I've been working on this and so more to come. So I just want to let you be aware of that and the public listening as well. But I do want to say our services have never stopped. They're being done in a different way, mostly remotely, but we've never stopped our services, and our buildings are still open, which is allowed under the governor's executive order. So at that, we are ready to move on, but I will want to close the loop back to Commissioner Savas, if you are available, to talk about the letter you had suggested about offering economic development jobs to our local businesses and contractors related to wildfires. Would you like the board to consider a letter? And if so, we can draft that for next week.
Yes, please, Gary. That'd be fantastic.
Okay, so Nancy, I'll ask if you could work with PGA and BCS and take the lead on that, and if you could bring it back for us for next week, please.
Absolutely.
Okay,
And I also ask that you make sure Commissioner Savas has an early copy to make sure his intent of what he wants to say is in that, maybe before you give it to commissioners.
Okay. Yeah.
If that's okay, because I'm not sure I heard everything that Paul wanted in that. And maybe that would save us some time on edits going forward.
Yeah.
Absolutely.
Thank you, Nancy.
great idea. Okay, very good. So yes, we're going to move on, and I'll ask staff to be as brief as possible. Perhaps we can finish by noon, but we'll do our best. So next is Senate District 24 appointment process and meeting. Chris Lyons from Public and Government Affairs will come on board here. He did email you a email with some updates. So Chris, please go ahead.
Okay. Hello, commissioners. Happy New Year. Here to update you on the meeting you'll be participating in tomorrow at 9 a.m. jointly with the Multnomah County Commission to appoint a replacement to fill Senate District 24. The meeting will be conducted virtually via WebEx, and you should have received a link to the meeting yesterday. So as you know, Shamia Fagan resigned the seat on January 1st. She was sworn in as Secretary of State yesterday. So this district, just to give you a sense of where it is, it begins roughly at the I-205-224 intersection, then heads north along the 205 corridor all the way up to the Columbia River. And it includes portions of Happy Valley and Portland, as well as the two counties. But a bigger portion of it is in Multnomah County, so they will be chairing the meeting. The Democratic Precinct Committee has sent 3 nominees forward for consideration, and they are Casey Jama, Adrian Enghouse, and Candy Emmons. And I'll note that the person who the two commissions appoint will serve in the Senate as the chair of the Senate Housing and Development Committee, as well as be a member of the Labor and Business Committee and the Ways and Means, Transportation, and Economic Development Subcommittee. So yesterday you received the meeting agenda. It includes Chair Kafori starting things off with intros and overview of the process. Chair Smith, you will be given a minute to give a statement, and yesterday we provided you with a brief statement that you can use if you'd like. Then there will be 20 minutes for public comment, opening and closing statements from the 3 nominees, questions from the commissioners. Each commission will get 2 questions to ask each nominee. There will be commissioner deliberation and time for commissioners to make statements, and then a roll call vote. Each commissioner may vote on 1 nominee, but the votes will be weighted by county according to the current registration within the district. So Clackamas each of the commissioners from Clackamas will get 25.89% of the vote, and Multnomah is 74.11% of the vote. What you need to decide on today is which 2 questions that you as a commission would like to ask the nominees and who will ask them. So yesterday you were provided a list of potential questions you can choose from, or you can develop your own, as well as the 2 questions that Multnomah County is planning to use for theirs. So with that, I will turn it over to you to deliberate on that and choose your questions and answer any questions.
Thank you, Chris. I appreciate that. I'm going to read my initial opening statement, but I'm going to defer any questions from our board to our other board members. We can decide here who wants to ask the questions first, who will be in attendance. I know, Paul, you have an issue coming up, but of course you're always welcome to participate. So first order of business, who wants to ask a question? And I suggest we have 2 questions, 2 different commissioners get to ask, and that would not be me. Hello. Martha, are you here?
I just unmuted. Yeah, I'll do one.
Okay, Martha, would you like to do one?
Yeah.
Sonia, are you here? Would you like to do the other one?
I'm okay doing a question, or if Mark would like to ask a question, I'm totally fine deferring that.
I'm going to ask our more senior commissioners at this particular process to ask the questions. So I would like Sonia and I would like Martha to ask the questions. Thank you very much for agreeing. Now let's decide what questions we want to ask. Do we need to decide that right now, Gary, or can they decide later? Because I really don't want to take a lot of discussion time to do that, because I've kind of put you on the spot to do this. So if Martha and Sonia want to agree on the questions they want to ask, they can submit them to us by email. I think that would be a better way to go about doing it.
Sounds like a
Okay, I thank you. Thank you very much for allowing us to do that. Chris, it was a very good briefing. Thank you very much.
Great, thanks for your time.
Thank you, Chris. Now, as you know, commissioners, you just heard Senator Alan Olson has tendered his resignation, so you will be doing the same process for his seat within the next 30 days. So more to come on that. All right, moving on. Next, board vice chair appointment process. Commissioners, I sent you a memo on this. Today is an opportunity to discuss who will be the next vice chair of the Board of County Commissioners. This is a seat that rotates between the non-chair positions, so the other 4 county commissioners. The role is you serve in the role as chair when Chair Smith is out of the office or not able to be the chair. So it's a rotated position. You make that decision the first business meeting in January, which would be this Thursday, and the role serves at the pleasure of the entire commission. So as far as rotation, you simply have rotated every year. Commissioner Savas is next up for rotation. So today is simply a chance for you to discuss if Paul will accept that opportunity, and you'll formally vote on it this Thursday.
Paul, would you like to be vice chair?
Sure. I pretty well stated last year and the year before that we just maintain the consistency in the rotation and keep it predictable. So I'm happy to do that and formalize that on Thursday.
okay.
Good. Thank you. I appreciate you willing to serve, Paul.
Great.
Next up, Gary.
Be on your agenda for Thursday. Next, your board ceremonial swearing in ceremony. If we could bring in Caroline Hill, please, from the board office, who is helping me and us with coordinating this. So this refers to Chair Smith, Commissioner Shull, Commissioner Schrader, as you were elected in 2020. You were already formally sworn in, so let the public know you're already sworn in, so you're official already. But this is our ceremonial swearing in that we do every year. So we have prepared both an inside and outside version for you to consider and asking you to make a decision today.
Froze.
So Caroline, please go ahead with your update.
Thank you. Good morning, commissioners. Welcome, Chair Smith and Commissioner Shull. So glad to have you with us. As Administrator Schmidt has said, staff got together to come up with a couple proposals that we could share with you for you to consider as we get closer to the January 13th ceremonial swearing-in ceremony. There was interest expressed to have an outdoor in-person event to occur. So we were considering possibly the west end of the Circle of Honor, the east end of the Circle of Honor facing west toward the flags. There are some things to consider as we have to follow certain guidelines from the state. We are limited to the number of people that can be attending this event, and that number is 50 people. Another thing that we need to consider is that due to weather, we might need to set up a few tents, or at the very least to protect our camera equipment and lighting equipment. At the very least, we need to have some tents for that. Another thing we need to consider is that because also the recent rains, we need to really stay off the grass. It is not safe to step on the grass. It is muddy and somebody could slip and fall. So another consideration to have about an outdoor event. Of course, as we consider tents, there are a variety of options depending on if we need to do rental of tents or if we just use what we already have available through facilities. Another thing to consider for an outdoor event is that it would not be live streamed on our Clackamas TV because we're not able to do that for remote events. We do have the option of doing a Facebook Live event, but we need to keep in mind that this is going to be using a staffer's phone number. So, there's going to be limited light, sound, possibly a shaky image for people to watch. We have considered an indoor option where we could pre-record the speeches from all three electeds and have them ready for January 13th, and so that we can push them through our YouTube channel, Facebook, and then we could also share the link with all of you so you can use your own personal Facebook accounts to share with everybody. It would be very far-reaching. There are some pros to this, and of course some cons. It's not in person, but the video quality would be significantly better. We can do it in the hearing room, which is already set up with controlled, pre-lit, great audio would be guaranteed. So I just wanted to kind of share what we have looked into and see if you have any questions and kind of open it up for conversation.
Well, I think I've made my preferences very known. I would prefer an outside event that's live. And I do have my own videographer coming, so I'm not concerned about the quality.
So really, this is for Commissioners Shull and Schrader and Chair Smith. This is your event, and so please let us know what you prefer, and we'll make it happen.
Do.
Commissioner Schrader, you're on mute.
Yeah, it's whatever my colleagues decide. I'm fine with. I've done this before.
Yes, you have. We've done it together before.
Yeah, so whatever you would like to do, I will be fine.
Commissioner Shull, do you have an opinion on this?
Well, I would like to see as many people there as possible. I know there's a lot more than 50 people who would like to come to this, and if transparency and involvement with the people of the county is important, and it is, it's just too bad that we have to limit it to 50.
Well,
Well, we'll go ahead then. As far as I know, we're going to cut this discussion short. We're going to do it outside, live, and then we'll let the chips fall where they may. As I remind this board, the presidential inaugurations go on January 20th every year in more extreme weather, and they're outside. And yes, I have been to them, and you wear your snow clothes and boots. And so I think our people can adapt. Thank you very much, Gary.
All right, so it will be Wednesday, January 13th, starting time 3:30 p.m. Want to confirm that still works? Your calendars are all clear?
Yes.
It'll be outside. We'll start promotion today, so we'll get the word out.
Thank you, Gary.
Thank you very much. Thank you, Caroline.
Thank you.
Next, hopefully these will go fast. Board retreat. Chair Smith has already mentioned this. Traditionally, in January of each year, commissioners, you have a board retreat. The purpose of this retreat would be to review your performance Clackamas strategic goals. And especially now that we have 2 new commissioners, if you want to stay with those goals or make any adjustments, to talk about financial priorities, and also to have some time for team building and how you will communicate with each other. I have 2 holds on your calendars for dates. The first is the end of this month, January 26th, a Tuesday, all day, and then Wednesday, January 27th in the morning, before noon, or the following week, Tuesday, February 2nd, all day Tuesday, and the morning of Wednesday, February 3rd. Do you have a preference on which week you'd like to do it? We'll do it in person. It will be open to the public. We'll find a spot where we can socially distance and do all those things. But do you prefer, is there a week that you prefer of those 2 options?
I don't have a preference. I'm more concerned about the work product. Commissioners, does anybody have a preference on dates on any of these? Gary, we're looking at an entire day, right?
All day Tuesday and then Wednesday morning, a day and a half.
Okay.
I
think
can.
the 26th and 27th, let's get to it. We've got business to carry on. I do want our board to come together and set our priorities.
great.
Travis and Commissioner Fisher both have their hands raised.
Oh, Commissioner Savas, thank you.
Yeah, yeah, that's fine. I did want to say that, I think it's important that we, take the time to do what I believe or have experienced in the past, you know, is a quality retreat, meaning we actually take the time, we, cover as much of the area or topics as we can, and if needed, have some assistance getting there, and make sure we have a strategy and an outcome or a work product that we want to accomplish. I know that we don't want to spend 2 days working hard and not have anything to show for it, and as much issues, or as many issues as we have before us and challenges we have before us, I think taking the time, adequate time, and if that's 2 days, it's 2 days. But I don't think, my experience is a county this size, we can't do a quality retreat in 1 day. It can't be done. It hasn't been done. It's never been successful. So I'd like to make sure that we have the time commitment to do it and do it right.
I would make a suggestion from all of our commissioners to email Gary and state what your expectations of this retreat would be. My very first expectation is budget discipline. We set priorities for the year on what we are going to fund, and we do not deviate from that. That is my priority. That is my expectation. I would expect my 4 other commissioners to likewise come up with something that they think is important. Commissioner Fisher.
Couple things, and I'm not sure if this is a Stephen question or a Gary question. I was always under the impression that budget decisions need to be made with the budget committee. That's my first question.
Stephen, do you want to take that? You're on mute, Stephen. Stephen, you're on mute. Stephen, you're on mute, Stephen.
We can't hear you.
Sorry, okay. So they won't be budget decisions. It sounds like it's going to be discussion, but those are going to be done in the open session on this. My understanding, half of this was going to be team building and half was going to be prioritizing. Is that right, Gary?
About 3/4 prioritizing, 1/4 team building.
Okay. Yeah, so Commissioner Fisher, the board can certainly have goal setting and budget setting discussions prior to the formal convening of the budget committee.
Okay, thanks for that clarification. And then my only other thought is the governor's recommendations that employers mandate virtual work to as much as feasibly possible. As all of you know, I have a very small law firm, take that very seriously. We've been working virtually as absolutely what is absolutely possible. And so I just don't know how this work is any different than what we expect employers to be doing across the county. And it just concerns me. So I bring that up as a concern. I don't necessarily like the Zoom format as much. I would love to be in person without masks and engaged as we normally would be, but we don't live in that world. And so that's a concern of mine. So I don't know, maybe we need to have a virtual option as well. So if
I would suggest that the reason for this retreat is that our board come together. And so we're able to associate with each other. We can learn about each other and become human beings again with compassion and understand our personalities. It's very hard to do on a Zoom. And this brings up some of the next 2 issues that I plan on talking about in depth. Gary?
So on the board retreat, so first, thank you, Commissioner Fisher. The governor's executive order did exempt public agencies. So we are allowed, of course, we want to continue being safe, but we are allowed to conduct business, be open for business, have employees working in the office. As far as the retreat, several things. This will be a facilitated retreat, and the plan is to bring in Marv Wiedner who helped you originally create the performance Clackamas goals.
Oh, good.
He'll facilitator. He will interview. He has a whole process. I'll share with you his proposal. He interviews you first, like before, comes up with the agenda that you agree with. He helps facilitate the retreat. I do suggest we start with a day and a half. And then if you want another one, we can schedule another one the following weeks after that. Look, we've tried 2 days before and we've not kept your attention. That was a prior board, of course, but we can do it ongoing. We don't have to do it one and done. So my recommendation would be continue, start with a day and a half. I'm hearing January 26 and 27 to do it in person in a large enough room that you'd have plenty of space between each other. But we could talk more about that offline if you wish. I just need to book the dates. That's all.
Yeah, book the dates. So I'd like to have an offline discussion too. But let's go ahead and tentatively set the dates. Thank you, Gary. And let's move on to the next item.
Okay, next business meeting agenda for this Thursday, January 7th. This is just a chance for me to give you a quick highlight of what's to come. If you have any questions at all, commissioners, please let me know and I can get answers for you prior to Thursday on any agenda item. You will have a presentation on selection of the vice chair as you discussed today. You'll have approval of your wildfire hazardous waste and debris emergency declaration that you discussed today. You do have a public hearing that is business from last year, a boundary change for water environment services. And then as I've emailed you, there's no consent agenda this week, but rather you will have 22 items from departments under a discussion item. And I've asked directors to come and present. They will give 5-minute updates. So I am asking you to please read your staff reports. We're not going to do 30 minutes per item. That would be here all day, but rather 5-minute verbal updates and then a chance for you to approve or not. The reason is too many consent agenda items it's not purposeful, I'll say that, but it slides through and you really don't have a chance to discuss them or have a full briefing. Going forward, all items that go on consent must be reviewed with you prior, either at a policy session or at issues. But for this first meeting, we're going to do it this way as discussion items. So that's the plan. Or the next item we'll discuss about this meeting in person or not. So with that, Chair Smith would like to propose to you board meetings in person going forward. So Chair Smith, please go ahead.
Thank you, Gary. I would like our board to attend our business meetings in person, our policy sessions in person, and also our executive sessions. I think it's important as our leaders, it's our responsibility to our constituents to be available to them. In our offices, Washington County has continued with this model. I think it's time that we get back into the offices and be available to our constituents. You're going to hear from me repeatedly is that as a governing board, we need to understand how to prepare and live with viruses for the future, known and unknown viruses. And you're going to hear a lot from me on COVID solutions going forward. In our county buildings, Gary has made the effort to try to get our county employees to come back. As leaders, we cannot expect our county employees to come back if we don't first do it ourselves. And I would expect our policy advisors and our fourth floor people to be back as much as possible. We have some special situations since our schools are closed. We can manage that. As far as Zoom meetings for business meetings, if a commissioner is out of state, for whatever emergency situation, we all have families, we have issues that come up. If there's a vacation, I think, that's possible to have a Zoom meeting for them. I think that, Commissioner Savas, you're flat on your back. I think that is perfectly acceptable for you to be able to call in, do a Zoom, whatever you feel comfortable doing. But for the rest of us, we're able-bodied, we can come in. As far as the public is concerned, I'm inviting the public to come in and give testimony. They also have the option to give their testimony by Zoom if they don't feel comfortable coming into the building. The constituents who do come into the building to testify will be using PPE. We will observe social distancing. We will have an instruction sheet passed out that Stephen Magcourt is working on for expectations of behavior. And since this is my first business meeting, I will be sitting at the dais in the chair position. I'm asking my commissioners to please join me as we move Clackamas County forward out of this abyss and into prosperity again. You know, our taxpayers have funded these beautiful buildings, and they're continuing to pay taxes on this, as many of them are out of work, as many of them are not receiving payments for their rentals. And I think we owe it to our taxpayers to continue to do this. Another reason is, as commissioners, I would like to see us keep regular business office hours, just for the main fact that I would like to see you. I would like to talk to you in person. I would like to be able to walk down the hall and say, hey, Commissioner Martha or Commissioner Fisher, what do you think about this idea? Is this even doable? And just have a little discussion, a one-on-one discussion, and also talk it to us with our policy advisors as well. I think it's just important as leaders that we recognize the social dynamics of being together. We hear that all the time from our constituents about that. I have had requests for Zoom meetings, and I said, yeah, come on over. My office is open. Come into my office for coffee. And I've had people say, thank you. I so appreciate you wanting to speak to me in person. I've had meetings already in my office. I've had meetings in the conference room. We have the facilities. We have conference rooms. We have the hearing room where we can be social distance. We can be safe. And I think it's very important that we set an example to move forward with this. I will be at the dais to conduct the meeting, and I recognize that you all are independently elected, but I think this is a first move of solidarity for all of us to move forward as a complete unit and show the community, show our public that we're representing them and we want to listen to them as much as possible. Comments, Martha?
Yeah, I just, let me see. Oh, I'm not on mute. Good. I'm fine coming in. I'm ready to come in. The caveat I have is that we are going to have to be trained in, as commissioners, I really believe this, because as we phase in staff coming in, we're going to have to set the example. And those are the cleaning protocols. Those are the sanitation protocols. Those are the distance protocols. And I'm not sure that I want our staff, for example, to have to clean our bathrooms. When I worked at the monastery, I cleaned the bathrooms. Okay. I mean this, I'm not kidding.
No, I'm serious.
In other
Hey,
words,
I owned an inn for 14 years. I constantly cleaned bathrooms.
well, no, but my point is this: if we do this, we can't put, and we're going to take a risk because this is a contagious virus. Fine, I'm okay with that. But we're going to have to take the responsibility, I think, really to do some of the sanitation. And I'm willing to go there with this. And that means wiping down our desks, wiping down the dais. So Gary, if we can get some kind of a list of what's going to need to happen or some protocols, I'll be the first to clean the bathrooms if necessary and do the, if I have to.
Commissioners, do you feel comfortable with the schedule? You know, Martha can take bathroom duty in the morning. I can take it afternoon, vice versa. I don't mind that. I can clean my own office. I'm very capable. I can clean my own space at the dais. I can clean my microphone. And I'm perfectly fine with that. I don't think it's going to take much effort to get those protocols in place because I think they're already being done. Gary,
Right.
what do you think about that?
So first, no one has to clean restrooms. We do have a janitorial staff at the county that is still working and does that. It's things though, look, for all of us, we have to wear a mask when we're not in an enclosed office by ourselves. We have to, we have wipes and cleaning, the Lysol wipe. We have everything in the office. You have to wipe down chairs and tables before and after you sit somewhere. So it's something we all have an accountability for, and we'll have the tools to help us do that.
Well, Gary, I know you think I'm joking, and I'm not trying to be silly, guys, but could we be exposing those other folks to something? That's what my worry is. That's why, I worry about it. I mean, if I'm going to go in there and let's say I'm COVID positive, I don't want somebody else going in, catching it from a surface or whatever. So I know people are doing it anyway, but so has that been a problem?
We know what they're doing in Washington County because a lot of counties doing that.
Yeah, Yeah, so Washington County currently under the extreme risk category is almost entirely remote. Their board is meeting remotely. Most staff is remote. Prior to that, though, yes, the board of Washington County Commissioners were meeting in person. A few were remote. It was a hybrid. Most staff were in the office, but not all at Washington County. Look, every jurisdiction has done it differently. There are cities in Clackamas County where 100% of employees, staff have been working. At some cities, other cities, 100% are remote. That's here within Clackamas County. So there's a whole hybrid of what public agencies are doing. So I would say if you are sick, don't come to the office, period. Anyone. But that's why we wear the masks and we do the cleaning, is if we may be a carrier, but we don't know it, then we're protecting ourselves and other people by using the cleaning.
Well, see, that's one of the issues I'm worried about, because this is something that people can have and be asymptomatic and be spreading it. So as long as we follow protocols, I'll be there. But I'm just going to suggest that other commissioners, I know that Sonia has a medically fragile child. So if we need to give people leeway, I'm okay with that too. But you'll see me at the meetings and you'll see me in the office.
Thank you, Martha. And I will remind the board, the governor has exempt public agencies. I am mindful of your concerns, Martha. You raised some really good points. I would expect nothing less from our staff. I would expect nothing less from the behavior from our commissioners to engage in this. But we do need to turn the corner at some point. We do need to start learning more about viruses. We need to understand how to live with them. We cannot be continually shut down month after month, year after year, hoping that they will magically go away. I do think that we can do this in a safe manner. If something changes for the future, it's a possibility of revisiting this. I've also considered putting 3 commissioners at the dais, 1 in the middle, 2 at the far end, and then 2 down in front, and then rotating those positions. But I think we can decide how we want to do that. The public, I don't see a huge barrage of public coming in, especially our first meeting or maybe our second meeting. And that's why the Zoom is available to the public to testify. So it is a hybrid model, but I think we are leaders of this county and we need to start leading forward. And especially since there is a move on many of our department heads with plans to start slowly bringing back our employees. We cannot expect more of our employees than we're able to give ourselves. And thank you very much for your consideration.
I totally agree with that. Okay, but you and I we'll tag team the.
Thanks. Yeah. Commissioner Savas. Commissioner Savas.
So Gary, if I go back several months ago when we were considering trying to go back partway, our numbers were obviously a lot less than they are today. I think the couple of things that stuck in my mind was, well, you really can't have more than 2 commissioners in the building at any one time for spacing and so on and so forth. So, and I'm not grabbing things out of the air here. I'm just taking some things that I recall were precautionary steps of how we would operate the county if we did a partial comeback, if you will, where we try to operate as getting closer to normal. So my question is, it seems that if it was 2 several months ago and conditions haven't improved, and now we're trying to do 5, what change is it prescribed, or what precautions are prescribed to get us to the 5? I don't have a problem with coming in to the office and conducting the meetings, but I think it's imperative, absolutely imperative, that we all take the precautions, and that people who come in the building know that other people that are in the building have taken those precautions. For example, you can't expect someone to go to the grocery store, or all these people go to the grocery store, and then 5 or 6 people aren't going to wear a mask, but everyone else is. I mean, everyone's got to abide by some rules, and that's got to be expected. So I'd like to know really what the plan is, and maybe Gary, this might not be the best setting, but maybe we can figure out a system or a method of how we are going to come back in a way that we can conduct our meetings at the dais or something near that, and how we make sure that the people that we invite into the building, whether they're constituents, whether they're customers, whether they're there to speak or they're there to listen, that they feel safe, that our employees feel safe, and that we are all abiding by the same set of rules. We can't have one of us or two of us or two other people in the building not abiding by the rules, because that's not going to make anyone else feel safe either. So that's a lot of responsibility, and that applies to virtually every person, being, department, space in the building we have. Does not apply simply to the Board of County Commissioners. So when I say that, I think we need to have a full plan. And I'm not, are we there yet, Gary, with that?
We're not there yet.
I would say we're almost there. I mean, we have protocols provided by the state, OSHA, and the federal CDC. We have, as you know, when you've been in the buildings, we have posters all over the place with all the protocols, and they're online for our employees and the public. So there are protocols in place of safety distances and safety measures. I will say, Commissioner, to your question, it changes. So when we last talked about this as a board months ago, the rules were different, and they've changed, state and federal. So we're constantly evolving and adjusting. That's why we're revisiting this again. So I do feel we have protocols in place, but it's different. It's different. And yes, there's a lot of fear out there, of course, but we have to be cautious and safe. And I feel we have protocols to do that.
Yeah, and I do realize that as the vaccine gets rolled out and the numbers of the vaccine start reaching the general public, not just particular classes of more at-risk employees or teachers or people in congregate settings and so forth, that when we get a widespread vaccine, I think there'll be a lot more comfort level, a greater comfort level with us meeting more regularly as we go back into closer to what we would consider normalcy. So I'm very, very cognizant of the precautions that people are taking in the medical industry, and I just learned this weekend that my niece, who's a nurse in the Sacramento area, with all the precautions that she's taking, including getting her first round of a shot, that she contracted COVID-19. So right, currently her symptoms aren't serious, but it should be a reminder to all of us that this is still contagious. It is still dangerous, and we don't know how this is going to turn out for people in different age groups. And so no one's really protected. And I would think that the last person that would have contracted COVID would have been my niece or my daughter, who does the same thing for a living.
Sonia Fisher.
Yeah, thank you. A few concerns. First of all, I think part of the reason why we meet is so that we can be a forum to communicate with our public. And if these meetings are done in person and everyone is wearing masks, it's very difficult to understand and hear what people are saying. So that's concern number one. Concern number two is that we are leaders and we do need to set an example. And we have asked the public to make tremendous sacrifices. And it's really concerning to me, while we are in the extreme risk category, that we do not really prioritize being part of the solution. And a lot of that is just limiting activity so that the virus doesn't have the opportunity to spread. So my concern would be, I would like to hear from our public health Dr. Present as to what she would recommend. I think about the way our office is set up, and the hallways are very narrow. It's not a place where I would feel comfortable walking around. I know that wearing a mask is challenging. It can fall underneath the nose. It's really uncomfortable sometimes to try to speak clearly. So you sometimes want to pull it away from your mouth, which is challenging as well. This virus travels indoors through aerosols, and it can affect anyone. So our goal is to keep the numbers down so that we don't overwhelm our health care facilities, and we've all been asked to make a sacrifice. So while we're at the extreme risk category, my vote would be, if everybody else wants to meet in person and feels comfortable with that, I think we need to have a hybrid option. And if we do that, somehow people need to be heard when they speak. And the other piece that I really want to emphasize is I really appreciate being able to see everyone's face. And this format allows us to do that. When we are on the dais, which there isn't room for 5 commissioners on the dais to be socially distanced, we can't see everyone's face. I think that in many ways, this format, especially for work sessions, is conducive to good policy making and decision making processes. So those are some of my concerns. I agree with Paul that as the vaccine rolls out, we are on the tail end of this. I was so thankful to hear from Philip that the vaccine will be effective against this new strain of the virus. We are on the tail end of this. If we remain vigilant for the next few months, we can be really much more a part of the solution than part of the problem. And it's, in the scheme of things, that will save lives. And I think it's more important to focus there. And Commissioner Smith, I am all about wanting to build relationship. The way that I've been really trying to build relationship with people is I have a deck off of my house. I have 3 heaters, and I have people on call to come over for whatever it is, for a dinner or for a coffee, or for, it's like, come over, it's almost 50 degrees and it's not raining. I hunger for that connection, and where it can be socially distanced without masks. I hate wearing a mask when I'm trying to connect with people. I think it's a huge barrier. And I have to say, I have a new baby granddaughter that's it's not even 3 weeks old. She's 3 weeks old. She was born December 12th. And wear a mask with her just for safety, but I hate it. I hate it. I would much rather be maskless for that communication. So anyway, those are all my thoughts. Please, if we do move forward, please allow us a virtual option. I have not, if I'm going to sacrifice seeing my daughter when we're in the extreme risk category, because I cannot do anything to jeopardize her or her group home, I can't see coming to a meeting where in this way. I mean, it's just as far as priorities go. So if we move forward with that, I would appreciate a virtual option.
I think that we can conduct our meetings in a very safe and efficient manner. There's efforts in the Oregon legislature to do the same. We have many lawmakers wanting to be able to attend the legislature. I think we can, in a very large committee room, commission room that we have, 5 people plus a couple staff people, we can certainly accommodate, as I've said before. We can have 3 commissioners sitting at the dais. We observe social distancing. We can have 2 in desks down the front. It is quite workable. I think we need a willingness to make it work. I think we need a willingness to move forward with this, and let's give it a shot. I will be there at the dais this Thursday.
Commissioner Smith, I'm okay to take the risk. That doesn't worry me, but I do want to point out though that to Commissioner Fisher's point, she does have a medically fragile child. That's kind of a different situation. So I'm okay having a hybrid model. I'll commit to coming in. I'll do whatever surface cleaning, whatever we need to do to make it happen. But I do think there's some special circumstances, and each of us has a different comfort level with risk. Okay, so let's just respect each other's comfort level with the risk.
Gary, do you want to put together a scenario for us and send out an email?
Yes.
Okay, Gary's going to handle that for us. And this is an effort of trying to move forward and being accessible. Keep one thing in mind, commissioners, something that I've heard for over a year now. As the constituency tries to communicate with us, they send an email into the commissioners and it goes into the general BCC. Our policy advisors answer it for us. We don't communicate a lot with the people who have concerns. So this is an opportunity to let the people come in and ask questions directly of us, either through Zoom. And I just think it's for open communications, and we need to start doing that. I don't need to tell you folks about what's going on in our communities with the frustration and anger of our people over the COVID. I do think that we need to start taking proactive steps in understanding this virus. HVAC systems, I've written a whole paper, it's on my website. I don't know if any commissioners have bothered to read it. It was penned, it's been peer reviewed by doctors, and I'm moving forward with that. I've discussed some of these things with Gary and Stephen Magcor and health officials as we move forward. So as we move forward and bring more employees in, there's a very concerted effort to make these two buildings at least more COVID-free and prevention. And there's a whole host of measures we can take, but they'll be up for board review. So I want to thank you for considering this as we move forward. And Gary will be sending out an email. Thank you. Next on the agenda.
All right, so Chair, it's at noon, and I don't know if Commission, I think we probably could be done in about 15 or 20 more minutes, but I'll give the choice, your choice, Chair. We can continue now. We can reconvene in the afternoon. Commissioner Savas can't be here in the afternoon, and he has two things he'd like to talk about. So maybe we can start with him and see where we're at.
Let's try to get this finished, and let's try to be brief. We're looking at liaison updates. Is that commissioner assignments? I would exactly what do you expect out of this last item, Gary?
If we could jump back up to where we were. So board evening business meetings, Chair, would you like to present your proposal?
Oh, right. I would like to have one business meeting a month that's in the evening to allow access to people who work during the day. We used to do that when I was here. We used to have the third Thursday of the month designated for evening business meetings. I suggest that we go back to that model.
Yep, I can support that. So I'm not sure where we are, but in the interest of time and knowing that I need to prepare to leave the home here and go to get my procedure done. Two things that come up. There's a letter. I don't know if staff could bring. If staff's going to bring it up. Is there a staff person that's going to bring that letter up?
Yes, Jamie Stasny from DTD, if you could bring her in real quick, please. This is to TriMet. There's a draft in your packet, commissioners. Commissioner Savas had requested this letter.
Yeah, I of course, as time goes on, you'll understand more of what's all the dynamics that are happening in transportation, but it is extremely fluid and changing and very, very concerning. So I'm not going to steal any thunder from Jamie as of yet, but I do just want to explain to folks that the general manager for TriMet last week resigned his position, and there's a push to replace him. And there was a letter crafted by some Metro members that they were trying to apparently do it in a certain way. A little bit of pushback, including Commissioner Bernard, I thought made some good points about pushing back on how we replace this person. The reason this is such a big issue, for just to paint you the picture of the county, is that Clackamas County has more transit agencies than any other county, primarily because TriMet hasn't really served a lot of Clackamas County, and we don't get a lot of service out of the area as perhaps we should. So therefore, a replacement and a process should be done in a very open way. So Jamie, if you could go, I have one proviso I'm going to add to that, but if you could just read the letter that we want to send to TriMet, and then if the board agrees, I'll add one little amendment to that.
Hello, Chair Smith, Commissioners, Administrator Schmidt. Thank you, Commissioner Savas. You gave great context. That's exactly how I was planning to introduce the letter. So would you like me to read the letter word for word? Is that your request?
Yeah, just for the benefit, it's not that long of a letter.
Okay, happy to do that. Chair Bruce Warner and members of the TriMet Board, we, the Board of Clackamas County Commissioners, are writing regarding the anticipated process to find and appoint a new general manager in early 21. For years, TriMet has worked to improve transit connections and to provide alternative transportation options for the residents of our region. We anticipate that TriMet's new general manager will continue this good work, and we hope that the TriMet board will ensure that the new GM will consider how TriMet can work to provide services that will benefit people throughout the Portland metropolitan region. While the majority of the urban area in Clackamas County is within the TriMet service boundary, there are also several small transit providers, including South Metro Area Regional Transit, or SMART, South Clackamas Transportation District, SCTD, Sandy Area Metro, SAM, Canby Area Transit, CAT, and the Mount Hood Express, who are essential to linking the rural areas to the greater Portland region. TriMet's partnership with these providers will be critical to ensure that transit service is as seamless, accessible, and convenient as possible to riders. It is also critical that these partnerships result in strategies that enhance cooperation and coordination throughout the region. Clackamas County's topography and natural features create unique transit needs and challenges. As we move into the next decade, we look forward to partnering with TriMet to address the gaps in transit service that exist in the county and to identify solutions that will increase both service levels and coverage in urban Clackamas County. We request that your new GM will consider other priorities, including providing all people with practical connections to jobs, education, and medical care, building transit solutions that bring services into communities and neighborhoods where people live and work to ensure usable and accessible transit access, partnering and effectively collaborating with other transit providers in the region to ensure the best possible service for all people in the region, addressing racial equity within the TriMet system to ensure that all users, particularly people of color, benefit from our region's transit network, meeting our regional climate goals, powering our region's economic recovery, and providing affordable housing and job options. We ask to be included in the recruitment process to help you find the ideal general manager. We join many other regional partners in requesting the following: that the TriMet board spend the upfront time in researching best practices to create an open and transparent hiring process for the next general manager of TriMet. That the board take the time to do a deliberate, open, and thoughtful process to recruit and ultimately select a candidate for this position. That the board use non-traditional consultants to run the recruitment process so as to show your commitment to equity, inclusion, and transparency. Prior to a recruitment period, conduct thorough engagement with stakeholders, residents, and users, develop hiring criteria that align with the values that we share with TriMet: inclusion, equity, innovation, mobility, community engagement, partnerships, and proven ways to significantly reduce tailpipe emissions. That any hiring process meaningfully involves city and county leaders and community organizations, particularly from region's small and mid-sized cities where expansion of TriMet service will be crucial in the success of equitable economic development, social justice, and climate action goals. And we ask that you include internal and external reviewers in the hiring process and at the table where decisions get made. You have several internal committees that should be engaged in this process and many stakeholders around the region that could be included in the process of identifying and the hiring criteria and be at the decision-making table to recommend candidates through the selection process. Please do not wait to involve the region as a whole and all of your regional partners in this decision. Your transparency and collaboration will result in the right process to find the ideal candidate. We look forward to supporting you in this effort.
I like that letter. One quick question I thought Wilsonville had their own transit agency in Clackamas County, not?
They do, that's correct. It's called SMART.
That was it. Thank you.
Yep, sure.
So thank you, Jamie, for reading that. I did want to add one thing, and the emphasis is because of there is work being done by ODOT, being done by Metro, and being done by the city of Portland on consideration of tolling all the roads in the region, all of the roads in the region. And ODOT's role is looking at tolling I-205 and tolling of I-5. The Board of County Commissioners sent a letter opposing that idea. And so I would like to add a sentence to this letter that basically touches on this. And basically, it would be right after the words, or right before the words, "We request that your new GM will consider these priorities," that it read, "If the region," and here you go, I'll start from the beginning. "If the region proceeds towards tolling or a regional congestion management approach, we will require bold leadership from TriMet and other transit providers in the region to ensure that our residents have a viable transit alternative along the I-5 and I-205 corridors." That would be my addition and proviso, only to put the emphasis on, we can't leave Clackamas County citizens left with no alternative other than to pay the toll and not give us viable options. And we've been pretty strong about that stand, and we need to take that stand again. So I'd appreciate your approval of that.
I don't understand for the hiring director why that language is necessary. But you know what, board members, if you want it, have at it.
So I'll move for approval of the letter with the amendment.
I'll second that.
Second.
Okay. I guess, Chair, you would ask Christina to poll us.
Yes, let's take a poll.
Commissioner Fisher,
Aye.
Commissioner Savas,
Aye.
Commissioner Schrader. Your microphone's off, Commissioner Schrader.
Aye.
Perfect. Commissioner Scholl
Aye.
and Chair Smith.
Aye. Passes. Thank you very much.
Thank
Jamie,
you.
do you have that language, Jamie?
Yes, I'll send it over right away.
Yeah.
Okay, great.
And I have one real quick last one is that Chair Smith, last 2 or 3 weeks, we have been putting together a task force effort, and we did a town hall for NCPRD. We asked people to submit their names by January 4th, which was yesterday, and that we would promptly approve their names and get them underway for a short window of about a month to do a task, which is basically put together a recommended structure under Gary's suggestion of using our citizen involvement committee structure. So to that end, I'd be happy to name the names of the people that have submitted their names so we can get them recognized so they can start their work underway and just approve that. And then my business is done for the day after that. And
Well, I have not been able to review that. I don't even know what this item is about, Paul. Gary said in his opening that these issues needed to be reviewed by all the commissioners. I'm not inclined to go ahead and approve something I've never heard of before. So I understand that it's too bad that the deadline was on January 4th, the very first day of the new commission. I think if we want to vote to extend the date for a week, I'm more than willing to do that, but I'm going to hold the line on approving something that we haven't had time to read or consider.
is it possible, Chair, that we could review that and approve that on Thursday?
Gary, is that possible?
Yes, we can send you a brief memo with the names today, and that gives you 48 hours to review, and then we can talk about it this Thursday at your business meeting.
Yes, I'm more than willing to do that, Paul.
Okay,
But I
thank you.
would do not, yeah, I do not want, I want to be very clear with the board and staff. I do not want to be surprised on any policy or initiatives or appointments or anything like this. I do need time to review those. I think that's only courteous with Commissioner Shaw and myself.
Okay,
And
thank you.
anybody else who may not know what's going on with this.
Okay, thank you, Judy.
You bet.
All right, if we could go back, commissioners, do you approve then having an evening business meeting of the board? Third Thursday, you decide which week, but we can do that. Is that, are we good with that, commissioners? Thumbs up, please, or nod your head. I'm seeing 1, 2, 3, 4. Yep. And
Yeah,
Paul,
So, Gary,
I'm good.
can we do the last Thursday of the month? Is that possible?
Why?
I don't care what Thursday
There's
is.
just conflicts. There were conflicts for third Thursdays. I'm not actually sure if there are still conflicts. I can double check and see if I
Well, what are
really
the
want to
conflicts?
recommend that.
Commissioner Fisher, what are the conflicts?
This is just the issue that came up last year. So I'm just wondering if that's an issue. I can double check. Didn't know this was coming up today, or I would have double checked.
Well, actually, Commissioner Commissioner, it is listed on the issues that Gary put out in an email, so it was noticed.
Right.
The whole list of them. So you need to provide what that conflict is. At this point, we're going to probably go ahead with the third Thursday, unless there's some huge, overwhelming regional whatever meeting. I just, Gary, you want to check on that?
yeah, I will. My memory is it was the county fair board met on the third Thursday, so our board rep couldn't go to the fair board meetings. That's my memory, but I'll confirm that.
Would you please? Thank you.
Yeah, and I do also want to remind everyone that the fourth Thursday was the city county's dinner on the fourth Thursday. So that's why
Are we doing in-person dinners?
not yet.
Well, then,
So we can stay with the third Thursday and not have that problem. That's why we didn't use the fourth Thursday before.
and what about the second Thursday? I mean, we could have a conflict with any of them. I don't know.
Yeah, I would be good with the second Thursday. I think having evening business meeting would be great.
Is there something wrong with the second? Gary, I'm going to have you take a look at the Thursdays for us, okay?
Let staff look at every Thursday in the month, see what is reoccurring. We'll get back to you by this Thursday, so you can decide this Thursday which week of the month you'll have your meetings. How's that?
Okay, let's do that. We'll just punt it and do it on this Thursday to decide.
Okay.
And do we want to start that for February?
Yes.
I'm suggesting we don't start it for January, but we start it for February for people's comfort levels.
Yes, please.
Okay.
Commissioners, you've been fantastic today. We're almost done. The last item is commissioner communications. This is a chance for you to communicate anything you wish. So Chair, you just call on commissioners one by one and they give their updates.
I am going to not speak myself. I don't see any commissioners with their little blue flag yet. I really appreciate every single one of you today. I think this was a very good meeting. I think we were able to express our feelings and our opinions openly, and I want to encourage you to continue to do that. Thank you very much. And Gary?
Guys,
Did anyone have anything? I'm sorry, you didn't raise. If you want to.
I don't see any little blue hands raised. Martha, do you want to say something?
I have stuff, but it can wait.
Okay, thanks. I appreciate that.
It's been a long day. Normally we won't be this long, but you have the afternoon free. So that's a gift you get by working so hard this morning. That is the issues list, Chair Smith. We are done for today. There's no afternoon policy sessions. You'll next meet as a board on Thursday at 10 a.m. for your business meeting.
Thank you kindly. Goodbye.
Good.